Hi, welcome to this Business Talk webinar with the University of Portsmouth. Today's topic, physical activity, is it the key to employee health? We've had plenty of questions coming in from the business community, and I'm delighted to have with me today two people who are here to help answer those questions and talk through the various options. With me from the university is Dr. Zoe Sainer. She's a senior lecturer in physical activity, exercise and health. Zoe, would you like to introduce yourself?
Yeah, hi everyone. So as Pete said, I'm Zoe Sainer. So I'm a senior lecturer in physical activity, exercise and health. I also am the lead for the physical activity, exercise and rehab research group at the university. So much of our research is about the benefits of exercise across the lifespan, whether it's your children to your grandparents. We deal with 4-year-olds up to people well into their 80s. We also do lots of exercise and physical activity for people who have various chronic health conditions. My final bias, I guess, to declare is that I am an athlete, so I'm a rugby player. I play for Harlequins. I've played internationally, so I'm a big advocate of exercise and physical activity, and I'm happy to take any questions on any of those topics.
Brilliant, thanks very much, Zoe. And also delighted to have with us today from industry is Craig Winter, who's the director of a company called Runner. So I think it'd be useful to come on to the first question, which I was going to come to you, to Zoe anyway, which is, and I think it's a good one for us to start with, which is what evidence is there that physical exercise actually makes any difference to an employee's well-being? And I suppose let's extend that question to say anyone's well-being, because we're all employees one way or another, whether it's working for ourselves or working for other people.
Yeah, I mean, it's a really great question, and we get asked this all the time. And you know, my bias aside, the wealth of research on the benefits, both physical and psychosocial, of physical activity and exercise is huge. So, you know, we work a lot with young people, and we know there are huge benefits of building this amazing machine, is the way I look at it. So, you know, as we age, we try and optimize health across the lifespan. So whether we're building strong bones, whether we're increasing muscle mass, whether we're improving somebody's ability to move, whether we're making the blood vessels nice and healthy, we know there are clear benefits of physical activity and exercise. And then, you know, as we get older, we know that the body starts to slow down a little bit. So again, huge physical benefits, but potentially the more important one now at the moment is also the mental health and the wellbeing aspect. And we know there's hugely, some fantastic randomized control trials, some fantastic case studies looking at everything from controlled exercise training programs in the gym to amazing things like open water swimming that have shown huge benefits on not only people with diagnosed mental health conditions, but the whole population. So a clear body of evidence from, you know, all the systems in the body to the mind to our bodies as we age. And yeah, huge benefits of exercise across the lifespan.
Okay, so in terms of, I suppose you're talking about physical exercise, and actually it makes a big difference. In terms of a working day and an employee's well-being, would those benefits, you know, can they mix? Can you sort of switch from a work-based environment, or perhaps in front of your keyboard, in front of your and you're in that sort of brain kind of mode, and then do something quick and simple to exercise, or do you very much need to segregate the day into this is my work and this is my exercise?
You know, I think it really depends on the person. And again, you know, there's going to be various people in the audience who are working at home. Maybe they have the flexibility to go to the gym and come back and fit in a shower. There are some people who maybe have, you know, an hour lunch break and they have 20 minutes they can dedicate to activity. You know, the basic advice we always give is anything is better than nothing. And, you know, modern life promotes us to be sedentary. We drive to work, we sit down often on our commute, we sit down at work. You know, at the moment during lockdown, I imagine most of us are spending more time at the computer than ever. And there's some fantastic studies out there of work-based interventions. So that could be, you know, there's a lot of hype about standing desks, and there have been some benefits shown of things like a standing desk. Obviously, if you move, you're going to get more benefit. So, you know, taking those breaks from the desk, even if it's just 10 minutes to go and get some steps in. We always strive for this 10 to 50,000 steps a day as a fantastic achievement as a minimum. And, you know, for some people at the moment, it's really hard to do that. I'm an athlete, I try and fit in my training sessions, but, you know, my Garmin watch keeps shouting at me that I've not achieved 5,000, let alone 10,000. So perhaps at the moment, it's maybe more important for people to factor in that, where the motivation may be a little bit lower, but there's definitely time in the day. You know, we all are different and we all have different goals. If you're training for something, you probably have a training program that's a little bit more pre-prescribed. But there's a fantastic application that I use called Outstanding that you add to your Google Chrome, and it just kind of shouts at you when you haven't got up from the screen, when you've spent too much consistent time there. And all it says is go and take a few steps and come back. And, when you look at the evidence of productivity, I know that was somebody's question, being able to focus, be efficient, even things like posture, making sure that you're sitting appropriately, that break is fantastic to come back, and anything is better than nothing. And probably has never been so important as the current period where we are spending far much more of our time sitting down.
Yeah, no, I would echo that. And certainly, I've also got a Garmin watch that shouts at me on a fairly regular basis. To the point where I'm beginning to wonder why I purchased an item to give me a hard time, but I think it's the right kind of thing to do. Craig, assuming that you're there and that we've got audio with you as well, you work in a business, I think, pretty much where not only do you espouse exercise, but you also participate in exercise. What's your view on, can it be worked together, and is there benefit for employees?
Yeah, I think physical exercise for anyone, whatever level it is, you don't have to be a marathon runner. You don't have to have been doing it ever, really. It's really important for people to be as active as they possibly can. And I think finding some time in your day, exactly like Zoe was referring to there, is that just finding time to get up, to move around. I've got the same thing on my watch. I can see how many steps I've done today, and it's quite alarming when I'm here working in my kitchen. I've only come down from upstairs, is that you don't move around as much as maybe we used to. So whether it's factoring in what would normally be your coffee break and your chat in the sort of staff kitchen area, use that time to go for a quick walk around the block. We've seen over the past few months more and more people have been using physical exercise as a way of their kind of, I'll say, stress relief, or their way of sort of combating any mental health challenges they're facing. So it's definitely something we try and encourage people to do more of when we're having conversations with them.
And do you think it's just to stay with you for a second, Craig, do you think it's a good idea to actually for an employer to build specific time for exercise into what they do, or even actually drive activities, or do you think that should be left to the individual?
I think if the employer can work with the employees to allow them the time and the flexibility. I think that having previously worked for companies myself, they gave me the time and the flexibility to whether it was using a gym or going out for a run. And I definitely felt that once you've done the exercise, you've got the endorphins flowing, and it puts you in a more positive frame of mind. So for me, if I'm sat in front of my computer, I'll try and make the time to go out and get some exercise in. I think it's about, obviously, each employer is very different depending on the sector they work in and what opportunities are there for the employees. But I think giving the employee the flexibility is a positive, and allowing them the time to be more active is going to lead to a more productive employee, which for a business is going to lead to a more productive person within your business, is going to help you achieve more. So I definitely think it's something that all businesses, where possible, should look to factor in.
Okay, and you, Zoe, I suppose, similarly, looking at your career, now you've had a career with Harlequins where effectively exercise was the day-to-day, and you've also now had a career perhaps where research, teaching, helping people on a one-to-one basis, but more screen-orientated is the day-to-day. Do you think that employers should build that time into the working day? Yeah,
well, I mean, actually, I do them both. And I've done them both throughout. So, I was playing internationally when I was doing my PhD, and I've played for Quins the whole time I've been at the University of Portsmouth. And, my boss, as both an academic and an athlete, but more importantly, a person, allowing that time that, you can demonstrate trust, that they understand, if you have a little bit more flexibility with your day, you're still productive, you feel so much better. And actually, for me and my experience, and similarly other people who I know who are kind of dual career, you're probably a little bit more efficient with your time, because actually you factor in that training session, the work that you want to get done beforehand. And yeah, I think it's hugely beneficial. And there's so much evidence, not only about productivity and things like that, but lifelong health, and actually the investment that, you're looking at reducing musculoskeletal pain, having happier, more productive employees. There's so much evidence out there. And yeah, I'm slightly biased, but having a job where, your boss is an advocate of exercise, obviously in sports science, we're all we enjoy sport and exercise, hopefully. And for the most part, that's the opinion. But yeah, I think it's hugely important. And that flexibility just allows you to fit that in with a little bit less stress. And people are tired at the end of the day, and some people prefer to get their physical activity in first thing. Some people like to do it at lunchtime, and I think it is important to capture what people are interested in doing. Not everybody wants to go and compete as an athlete, but actually just giving some of the flexibility to have that hour in the day, I think is a nice tool to have.
Okay, thanks very much. And sort of following on from that, because one of the questions we've had here, which I think you've probably already answered, but it's worth us just exploring it, which is somebody saying they've heard exercise itself becomes addictive. Isn't that counterproductive to an employee's well-being? So is that a likely scenario, or do you think that actually the other positives would outweigh the potential negatives?
Yeah, I mean, I'll jump in first. And, as I said at the start, I mean, I'm largely interested in the physiology, but we do delve into the quality of life and the well-being. You hear lots of anecdotal reports that exercise can become addictive, but delving into the literature, there's reports that it's only about 3 to 5% of people actually have this, what is relatively new diagnosis of exercise addiction. And that's, uncontrollable desire to go and exercise. And they did some research where, people are avoiding sleep. They're being paid to sleep, but they avoid sleep because of their desire to exercise. And that's pretty rare. I think, yes, there is a potential for physical activity and exercise to become addictive, but that actual diagnosis of being an exercise addict is pretty low. And we work a lot in the clinic setting with risk benefits. We know in certain groups there may be risks associated with exercise, but the benefits can be huge. And it's all about undertaking it safely. And I think the same applies for the population. If you can get somebody safely engaged in more physical activity than they were doing, there's huge benefits that I would say outweigh those risks in most cases.
Okay, and coming to you, Craig, and just reflecting on that, I think yesterday the Chief Medical Officer said that actually people need to keep going just simply because of the risk of COVID and the impact it has on people who are overweight. Does exercise addiction something you come across, or do you agree with Zoe?
I think I'd say addiction is probably too strong a word. But a lot of people would say they are addicted to exercise, but not to the levels that it becomes dangerous to themselves. I think what we've seen is, for us, since we started Runner 4 years ago, the social media has been brilliant and tapping into the running community. So people that are based all over the UK and further afield. And what you often see is someone that's not used to running or doing exercise will become addicted to it, and they'll actually realise it's their thing and it's something they can do. All they need is a pair of running shoes, shorts and a t-shirt, and they can head out. And I think that what you see is now people that, whereas they may have run once or twice a year, are now going out a couple of times a week. They need to make sure that they're listening to their body, so they're not over running or over exercising. You need that downtime to let your body rest and recover. But I think it's the amount of people that have gone through something like a Couch to 5K program when they never thought that they would exercise. What we've seen is over the last 16 weeks, so the last 4 months since the lockdown started back at the end of March, is a lot of people have realised that they need to be more healthy. One, from a health aspect of everything that's been going on, is that physically they need to be healthier, but also just because there's been less things for them to actually do, it's been a bit of a nudge, bit of an encouragement to get out the door and do some exercise. And I think we've seen many people that have been either taking up running for the first time, or they've been going from a Couch to 5K, and they've been going from a 5K to a 10K, and they've been seeing how far they can get. And it's really positive to see. And I don't think, personally, I don't see a downside to it. I think it's just listening to your body, making sure you take that time to rest and recover, so that you're not running on aching joints and limbs and other bits and pieces.
Okay, and then sort of moving into a question which I think is quite pertinent. So obviously we had the initial lockdown. Swimming pools are still currently closed. I think gyms generally are still currently closed. I think there are some that have opened up where they actually have the space to do so, but as a general rule, I think most don't. And somebody has put this question in here: do I need to join a gym to exercise? And I think it'd only be fair of me to go to Craig first with what he does, and so say, what do you think, Craig? Probably a biased answer, but do you need a gym to exercise?
No. The great thing about running is I understand why some people do sign up to gyms, because it's almost a way of thinking, I've got that monthly subscription, I must go to the gym and use my subscription to get my exercise in. But again, from what we've seen living here in Portsmouth, not far from the seafront, is that all you need, again, a pair of trainers, shorts and t-shirt. You can run however far you want, at whatever speed you want, whenever you want. So running is brilliant because it's open to so many different people from whatever backgrounds. people can get involved with it in their own leisure. So yeah, I'm definitely you don't need to sign up to a gym to get your exercise.
And so just coming to Zoe briefly, obviously Craig is the running guru and the supporter and the proponent of that. Are there areas where people could potentially do if it's not the gym?
Yeah, and running is amazing. I've actually had a leg injury the whole of lockdown, so not been able to run and had to find alternatives. And, if people are looking for aerobic exercise, there's been a huge increase in how many people have bought bikes. Again, where we live, people going paddleboarding and things like that. Amazing aerobic exercise, getting you outside, getting you away from the screen time. But we can't forget resistance training. I am a rugby player and an advocate of that, but across the lifespan, and what actually lots of research and lots of the medical research at the moment is already forward thinking about, we're going to have lots of people who haven't been stimulating muscle growth, and we need that for many reasons. We also need, muscle stimulation is linked to things like diabetes, and we have to be using our muscles. And if we don't, or we don't do some kind of resistance training and we do go running, Craig looks nice and fit. There are some people who maybe we shouldn't say, first of all, go out and run that 5K as fast as you can. So things like simple bodyweight exercise, there are really cheap bits of kit, things like TheraBands that actually you'd be amazed how tired you can feel by doing simple exercises. You can do bodyweight exercises as well, whether it's your press ups, your sit ups, your squats, you can actually get an amazing whole body workout. And I've got a kind of mini gym now in my lounge that's been built over lockdown. And actually there's lots of research happening there now. And I guess one of my straplines we always say, especially with some of the groups we work with, is it has to be a safe recommendation. And for some people, that is a little bit more of a kind of resistance training or going through simple movements, making sure you're not putting yourself at risk, of injury when you go out there. But like Craig said, most people, if you know your limits and actually look at simple things like your heart rate, for some people, a brisk walk is much more than they were doing. So you're going to get the training benefit and you're going to feel great. And then it's about maybe consulting with somebody, if you are a novice, who can give you that advice to get you safely on there so that, again, you have a good experience. Because the key thing is if you have a great experience, you are going to hopefully be hooked and not an addict, and you're going to stick with this, as long as time goes on. So, yeah, that's probably my advice as a non-runner.
It's useful to have because I'm a runner, so I would have said exactly what Craig said. So it's good to have a bit of perspective on the call. Following on from that, and I'll stick with Zoe just initially, and then we'll come to Craig. And one of the questions that's come through is that people's asking the question, what exercises can I advise my employees to do throughout the working day? So I suppose in asking this question, it's probably worth splitting it into two bits. And one is probably, what exercises could you do in your working day? So, if I'm stood at or sat at my desk or everything else. And then I think we covered earlier the idea of giving people some flexibility, and then maybe come to Craig for, what could they do if they had a significant portion of time. So Zoe, if you had somebody coming to your research group and they're sort of saying, I want to do more things, but actually I'm at my desk all day long, what can I do? What would you sort of recommend?
I mean, the first thing we do is try and split it into three things. You've got your structured exercise training, which again, Craig can talk a little bit more about that. You've got your physical activity that you're doing. And then what everybody forgets is your sedentary time. We even see in elite athletes that you maybe do an hour of exercise training, but you could sit down or lie down or sleep for the other 23 hours. And that's not great either. So you have to look at these three things. And my first thing is trying to break up that sedentary time. And, if we put the structured exercise training to one side, break up that sedentary time, add more steps into your day. If somebody is pretty inactive and what we would class as sedentary at the start, I would always say have those simple goals of accumulating, 10,000 steps in a day. They don't have to be in one go. If you go for an hour, you'll probably get that done if you walk briskly, but accumulate those throughout the day. When we look at things that you can do at the desk, there's amazing kit. If you want to go and invest, you can get a all singing, all dancing standing desk that has a bike underneath, and you could do resistance training, but we don't have to do that. Simple stretches, looking after your neck and your back. Things like mindfulness, Pilates, yoga, there are amazing apps now that you can plug in. There are ones that you can literally do at your desk, sit there for 10 minutes and just, think about what your body's doing, think about your posture, think about your heart rate. And for me, that's kind of the lowest level, is breaking up the sedentary time, thinking about, mindfulness and bringing some of those things into the day. I do that. And my structured exercise training is later in the day. I know I've got an hour to 2 hours that maybe I've got a program of resistance training, a little bit of exercise on the bike that I want to do. But there's some fantastic things you can do. And my thing, same as Craig said, is at the moment in lockdown, we don't have the things that we used to take for granted, which is even the 5 to 10 minute walk from your car to work. I used to get 10,000 steps, no problem, just walking in, and I drove to work, and that's gone. Going to the kitchen that's now, in the room next door. And actually, for most people, we've been doing survey research and we've been capturing data on thousands of people during lockdown. Lots of people aren't accumulating these basic physical activity guidelines, which aren't a lot. If you look at them as 150 minutes moderate to vigorous activity, that's not necessarily going running, it's not doing training, it's just moving. And actually that's where I'd say, Craig, you can probably give some really great advice about the structured training, but break up sedentary time is my golden thing.
Okay. Yeah, definitely. I mean, for me, it's I think planning your exercise not as far in advance, but in advance is a great thing, because it's very easy to say, I'll go for a run at some point, and then before you know it, the day's gone, the opportunity's missed, and it's the following day. I think Zoe mentioned mindfulness, which is really, really important. And I think we've seen anecdotally the number of people that have been tapping into, you can get apps like Headspace, which you can listen to, you go to bed, you can listen to in the mornings, you can listen to throughout the day. I think that's really, really important. I think things like podcasts are really good. So when you're at your desk, listen to things that you take positivity from, because being physically active is great, but I think you need to be mentally in a as better position as you can be. Definitely puts you in a really good position. For me, I do try to plan my runs in whenever I can. I think the majority of people now don't have a commute to work, so we know lots of people that are using that time when they would usually commute to go for a run or to go out and be active, whether it's walking or running. So I think it's kind of looking for opportunities where maybe you wouldn't have necessarily looked at those in the past. If you find yourself on the phone a lot, I mean, I've been doing it a few times, speaking to customers, suppliers, other people in the world of running. Go for a walk and talk to them when you're on the phone, because I'm currently sat at my breakfast bar in the kitchen, and it's kind of like, it's great, but it's not, I can tell my posture's poor. As Zoe's talking about it, I'm finding myself sitting up. It's all of these things that normally you would be in probably a slightly better environment. But I think there's just any opportunity to kind of be active and mobile, try and grab it, but try and plan a little bit further in advance than maybe we all are at the moment.
Okay, that's really helpful. And so sticking with you, Craig, it's kind of follow-on question that somebody put in, which is, what are the best exercises for people who have not exercised before? So I suppose if actually someone came to you and said, I've never exercised before, or it's been very little, and I now want to do something about it, I'm in lockdown, what if you had to say, what would the first bit of advice be?
I think, as we've seen, a lot of people have been getting into doing more exercise, and I think it's honestly what I actually do is try and point them in the direction of an expert who is someone that's going to know about the body and about what that person is capable of. For me, I've always been a runner, so for me it's fairly easy just to put my kit on and go out for a run. I think every person is individual, and Zoe will probably know way better than myself, is that they need to do the right thing for what's right for their body and listen to their body. And I think some people will just start a couch to 5K program are great, but I think and again, Zoe touched on it earlier, you need to build up the muscles in certain areas of your body that to compensate for. We see lots of people that get injured really, really easily and really quickly, and it's because they probably don't think about building up strength in their muscles. And I've been guilty of that in the past, because I've done marathons and I just run, and I never do enough of the stretching, all of the other stuff I know I should do, and I know I should do it, and I just kind of forget about it and don't. So I think it's very important that people kind of get a program that's tailored to them, whether it's through a personal trainer, whether it's through, it could be physios, it could be just someone who's kind of expertise in that area.
Okay, and then just flicking it over to Zoe, if you had to give that advice, someone never exercised before.
Yeah, I totally agree with Craig. So lots of our work is with clinical populations as well. And the first thing we always do, and every gym will do it when they have a new client, is a pre-screening. Have you got underlying health conditions? What's your body mass index? What's your body weight and how tall are you? All that kind of simple information. Actually, in the current climate, there's not as much of that going on. So the best thing is to find, like Craig said, invest. You're investing in your body and your health. Invest in that expert who can guide you. You're not having to sign up for months of personal training, but one session that will help guide you, point you in the right direction, evaluate your baseline is fantastic. And again, reach out to these people. Never before has there been so much online. We're working with a group at the moment that in 6 weeks, from nothing to yesterday, has launched a complete online platform for people who have kidney disease. And we know this is all the experts from across the UK. It's appropriate and safe exercise, physical activity guidance, and really disease-specific stuff looking at mental health. And that's coming out there for all kind of different groups, ages, interests. And like Craig said, you may love running. You may hate running. You may be a cyclist. You want to get involved in a local cycling team. There are so many things popping up now. And I guess, again, my kind of caution as a scientist for the online stuff is invest and make sure that that is appropriate for you, appropriate for your health status, and matches your interests. Just because you try one activity and you don't like it, please don't be put off by physical activity and exercise. There will be something that you enjoy.
Okay, brilliant. That's good advice. So penultimate question, which really I think we've probably answered, but I'll ask it anyway because someone sent it in. And this sort of says, I employ 8 people. How can I encourage them to take physical activity in their own time? So get confused then. So actually, I've asked that question already. I was meant to ask the question, should I continue to give my employees time within their working day to exercise once we're all back in the office? Beg your pardon. So is it a lockdown only thing, Zoe, or actually should we try and do this once we're out the other side? Maybe a fairly rhetorical question.
I think you have to. I mean, so I mentioned earlier, we've been doing some research as this is going on, and we're continuing to do research. And the first study, I can't divulge all the data, but key themes, and it's currently under review, have shown that physical activity is a key determinant for mental health and well-being. And that's across Ireland, the UK, Australia, and the US. And we've got a massive data to show that. And that's only, a few months in. This is going to be a long slog. And we know that it's key now. It's going to be key moving forward. And we've seen a key theme as well, particularly in females, that they're having this positive behaviour change. So in simple terms, that means you're doing more than you were doing. And Craig mentioned, again, lots of people taking up running. So if people are having this positive behaviour change, let's continue that. Let's facilitate it. And actually, people put lots of barriers in place when we say, why do you not exercise? It's time, it's lack of resources, lack of knowledge. And actually, if you've got any employees who have gone through this positive transformation and positive change, support them, as my advice, because, we know that childhood physical activity largely dictates what you do as an adult, but we can transform as adults. And again, when you've had that positive affect, you've enjoyed that exercise session, please help them is my biggest advice, because, it's not about the acute benefit necessarily, it's the long-term investment that if you've got healthier employees, happier employees, they're going to have less sick days, they're going to be enjoying their work, they're going to be more productive. So it's a win-win, in my opinion.
Yeah.
Thank you, Zoe. And Craig, would you agree with that?
Yeah, totally. I mean, one thing to probably, I think people maybe slightly overlook, but I think in the last 4 months since lockdown started kicking in, I think people are a lot more aware of their own mental health. I think it's become, over the last couple of years, mental health has been much more of a talking point, where it's been widely accepted it's okay to talk about mental health, and that's for men and for women. And I think what people have really realised since we've had certain things we take for granted taken away from us is that your mental health is really important, both as an individual, both as an employer, both as an employee. So I think for businesses that are looking, people going out and being active is not just a physical benefit, it's also the mental benefit. And I think that has long-term impacts for both individuals and for businesses. So I think it's definitely within a business's and an employer's interest to let their employees be more physically active, because it's going to have that sort of impact on people's mental health at the same time. So yeah, totally agree with what Zoe said.
So before we bring this to the close, because that's the majority of the questions that we've had, I said I'd come to you for anecdote, physical, sort of a positive example of things going on in this area during lockdown. So coming to you first, Zoe. What's the positive that you take for this topic area in our current time?
I think I just draw upon some of those key things I said in our survey, that there are lots of people who, for various reasons have found this ability to be more active than they were beforehand. And we have to do that. I see it in my dad. My dad has diabetes. He's lost about 2 stone. He's not actually gone and done any structured exercise training. He's just less sedentary. He's moving around. He's out in the garden more. And in our survey, we picked up kind of activities people are doing: gardening, more work outside, more housework, and they're actually online platforms. These are huge things that, when compared to pre-lockdown, people are engaging in. And for me, that's exciting. And the infrastructure, people coming together, collaborating, experts informing these applications, these online platforms. It's absolutely fantastic. I'll give that kidney example again. From 6 weeks to go from nothing to a fully fledged launched online platform that's a UK-wide collaboration is amazing. So, these things are happening, engaging them, help people, help push them forward and use them. Yeah.
And Kevin, to you, Craig, there's a final kind of word.
Yeah, I think. But for us, it's been the people that, similar to what Zoe said about, in terms of they thought beforehand that they couldn't be as physically active as they have been, which is amazing to see. I think one of the positives you see is the running community, especially the community we're in, is how supportive they are, how encouraging they are. Is that people have been achieving distances and times, and they're not setting new world records, but they're achieving things they never thought they could achieve. And you see people from all walks of life coming together and supporting and encouraging each other, and it just gives. We're kind of used to hearing negative stories all the time about what's going on in the world, and there's a lot of it's very trying times, but there's so many positive things. Captain Tom Moore that did his huge £32 million fundraising. It's like there've been some amazing stories that have come out of some really testing times, and I think it's great to see people taking positivity from that and transferring it into their everyday life, both physically, mentally, and everything they're trying to achieve. So it's been some real positive things to look at.
Okay, thank you very much. That's the end of our questions and end of the general debate. I'll just summarise some of the things that have come out of today's conversation. So a few things that I was taking away from it: build routine into the day. From an employer perspective, build the time and flexibility for employees and use it to demonstrate trust and flexibility. And that really does work quite nicely into some of the other webinars we've done on working from home and managing team wellbeing and everything else. And that trust and flexibility plays a huge role there as well. And bearing in mind that exercise puts you in a positive frame of mind. I think we've debunked the myth of exercise addiction with Zoe sort of saying that research shows only 3 to 5% of the fitness population suffer. And that, generally speaking, benefits more than outweigh that concern. I think, Craig, you've kind of said to us that running is simple, and look at those other kinds of resistance training. I particularly like the point from Zoe around sedentary time, about breaking that up and the simple things that we can do. And from a personal perspective, I'm mindful of that. I used to get all my steps in by moving from one university building to the next to go and see people through meetings. And now the distance back and forth from my house to my shed is not that far. From the working perspective, but also incorporating Pilates, looking at those podcasts, how they can give you a mental kick and a positive. And that if actually you are somebody who is exercising for the first time, then maybe get an online trainer's advice, that one big first free or paid for session to set you in the right frame. But overall, I think the overwhelming statement from both of you is it's super positive. It's got huge benefits. Continue it outside of lockdown, and so generally keep it up as we go. A huge thank you to Dr. Zoe Sainer for joining us from the Department for Sport and Exercise Science, and also Craig Winter from the Runner for joining us as well and answering those questions. Thank you both for your time. It's much appreciated, and we will see you all on next week's webinar.